Hello, my name is Dr. Shubham Garg and I'm a cancer surgeon at Fortis International Oncology Center in Noida. 16th November happens to be the World Pancreatic Cancer Day, and we are providing you this information in conjunction with GoMedi Medical Services, which is a very valuable partner for Fortis Hospital, and they help us to reach out to a lot of international as well as domestic patients. Pancreas is a very small organ in the center of the abdomen. It is snuggled between stomach upwards and the colon below. The size of pancreas is hardly around 3 to 3.5 centimeter, but it's a very vital organ when it comes to our digestion as well as hormone production. The two major functions. The most important about pancreas is that it plays an important role in secreting a lot of enzymes which are required for breakdown as well as digestion of proteins, fats and carbohydrates. Pancreatic juices which flow from the pancreas into our gut combine with the biliary juices, and then they break down all the food that we have taken in and which passes through the stomach. The second major role of pancreas is in the production of a lot of hormones which are required for our daily requirement. The one that I am very sure that you are very well aware of is the production of insulin, which happens in the tail of pancreas. Other than insulin, a very other significant hormone that is produced in the pancreas is glucagon. Both insulin as well as glucagon are involved in management of sugar within our body, and mismatch or malproduction of any of these hormones can lead to severe changes within our bodily system. Now, when pancreatic cancer affects any of us, it can play havoc with not just the digestive system but also with the hormonal system. Hence, pancreatic cancer is something that we have to be very watchful and try to detect it in the early stages. Now, the incidence of pancreatic cancer is not very high. It happens to be between 0.5 to 1 case per 100,000 population within our country. Even within this population, women are at twice the risk as compared to the male population. But it is not the numbers which make it important, it is the significance which pancreatic cancer has in our body which makes it important. Pancreatic cancer has amongst the lowest survival rates worldwide amongst all the cancers, and hence it is recommended that the earlier we diagnose pancreatic cancer, the better it is. The most common symptoms that a patient might present with pancreatic cancer is sudden loss of weight and definite loss of appetite. Advanced cases, patient may also present with pain in the center of the abdomen, and the very characteristic of this pain is that the pain tends to radiate back, or the patient complains that the pain is tearing into the patient and coming out of the back. This is the typical history which a pancreatic cancer patient may present with. The very common second symptom which is seen in pancreatic cancer is those of obstructive jaundice. The mass which forms in the pancreatic head blocks the flow of bile into the intestine, and this leads to yellowish discoloration of the body or jaundice that we very commonly know of. It can also produce itching all over the body along with white colored stools. It may also present with high grade fever which is associated with chills and trigger. These are the symptoms when the disease is confined to the pancreas, but when it goes out of the pancreas, the patient may present with bloating of abdomen, a feeling of fullness after meals, or shortness of breath or respiratory difficulty. This is very commonly seen when the disease has spread either to the liver or to the lungs. But the question arises that who is susceptible to this kind of disease? Now, there are no very clear answers to this question that who is at risk of getting pancreatic cancers, but it has been found that patients who are obese in nature or who have very low physical activity, patients who indulge in smoking, or who have a very significant genetic history or a family history of having pancreatic cancer may be at risk of developing a cancer of the pancreas. Again, this is all with the previous literature we have. There is no definite studies which have been done for the causation of pancreas, but this is a correlation that we draw out of the so many patients that have been seen by so many experts. If I talk about the stages of pancreatic cancer, the stages are four in number, where the very first stage begins with tumor as low as 2 centimeters in size, and these are the first stage cancers which are difficult to detect because they usually don't cause any symptoms and might not be obstructive in nature. The second stage is when the tumor increases in size and can present as a mass. This usually is associated with obstructive symptoms and can also cause pain if it is impinging on any of the nerves. Third stage cancers are those where it usually grows out of the pancreas and can infect or affect surrounding blood vessel or surrounding lymph nodes, and it is this point in time where we feel that it is not amenable to surgery but might require some other treatment like radiotherapy or chemotherapy. Stage 4 is the most dreaded variety, where the pancreatic cancer has spread out of the pancreas and gone and involved other organs, just like I mentioned before, liver, lung or bone. It is in this stage where we feel that any of our therapy might not be helpful for the patient, and it is this stage where we feel that control of the disease is more of paramount importance than cure of the disease. The treatment of pancreatic cancer also varies according to the stage as well as the condition of the patient. If the patient is diagnosed in the first or the second stage, surgical resection is the best possible treatment for this kind of cancer. Surgery entails a major surgery. It is also known as a Whipple's procedure or a pancreaticoduodenectomy, where you remove not just the head of the pancreas but also a part of the stomach as well as the gallbladder and the bile ducts. The anastomosis that is required are also threefold in number, and it includes a pancreaticojejunostomy, a hepaticojejunostomy and a gastrojejunostomy. This surgery, like I told you, is a complex surgery and requires to be done at high volume centers in experts' hand to get the best results. This surgery can only be offered to patients who are fit in nature or who don't have any major comorbidity, because the surgery lasts around 6 to 7 hours and requires for you to be in the ICU for at least a couple of days. If we feel that the disease has extended beyond pancreas and may not be amenable to surgery, the next best option is to go for a neoadjuvant chemotherapy or some cycles of chemotherapy so that you can reduce that disease and make it amenable to surgery. If it does not still respond, then probably chemotherapy and radiotherapy in a combination and a concurrent matter is the only way forward for trying to control this disease. Stage 4 tumors, unfortunately, are said to be incurable, and like I said, control is the only treatment possible, where we give you systemic therapy in form of chemotherapy along with some immunotherapy to try to control this disease. The common side effects of chemotherapy, as we very rightly know, are loss of appetite, fall of hair, a general sense of well-being. It might also be associated with reduced immunity as well as nausea and vomiting. However, with addition of immunotherapy, these drugs empower your immune system so that it acts against the cancer cells. Immunotherapy allows us to give you more stronger drugs, and they cause lesser systemic effects, which allows better killing of the cancer cells. Spread of pancreatic cancer, like I told you, is something which happens very fast, and that is why time is of paramount importance. We have seen patients where they probably come to us in a first or second stage, but the time that they take to get the investigations done, it can spread to other parts of the body, and pancreatic cancer is said to be a very, very aggressive cancer, and it can go beyond control in a very short time. The survival rates for stage 1 and stage 2 pancreatic cancers, we always talk in terms of 5-year survival rates, vary from 45 to 65%, and this depends on the type of pancreatic cancer that you have. However, the chances of 5-year survival in a stage 4 pancreatic cancer is less than 10%, and that is why it is of paramount importance that we have to listen to our body if there is any cry, if there is any symptom which can prompt you towards getting an investigation done, please get it done, because only and only if can you detect pancreatic cancer early, can you actually cure it. Otherwise, you are always chasing the cancer and are unable to cure it. With these words, I very sincerely put a humble request again to all of you who is listening to us, that please take pancreatic cancer very seriously. Days like Pancreatic World Cancer Day give us an opportunity to inflict on you how bad this disease can be. And with partners like GoMedi, we can only reach out to our patrons so that you have a healthy life. Thank you.